I welcome all the students for this theory class, Introduction to Preclinical Prosthodontics. I am Dr. Srinivas, Professor and Head, Department of Prosthodontics, Narayana Dental College. Prosthodontics is one major clinical department where we come across with patients or the individuals for the purpose of rehabilitation. In simple, we call it as a replacement of missing tooth or structure. The faculty who works in this department are specialized and associated with the Indian Prosthodontic Society, which was founded in 1973. As I said earlier, this department deals with the replacement of missing tooth. Most of the individuals or most of the patients who visits these departments are elder people who have gone through a lot of struggle through years for so many reasons. Hence, the management or handling of these particular patients requires special attention. There is a lot of meaning why I said special attention towards this elder age group people, because the elders who visits our Department of Prosthodontics or our clinic may be compromised with one or the other reason, like physical disability or the compromise in their medical situation or the financial issue. So having a thorough knowledge about the theoretical aspect, clinical as well as the laboratory work is mandatory and must to handle these cases. Handling them in gentle way, building the reputation as well as the confidence with them is one of the primary criteria or one of the primary important aspect here in this department. Rehabilitation of single missing teeth or multiple missing teeth or complete dentition definitely improvises the masticatory performance or the chewing efficiency of this elder age group, so that their general and physical health as well as well-being will be restored. Any disappointed cases or failure case may not report us very frequently to our clinic because of the compromises which I have mentioned earlier. Maybe a physical disability or the medical issues, they may not report us, but to maintain good clinical practice as well as the ethical practice, we must know the different clinical as well as the laboratory work aspects to satisfy the patients. In prosthodontics, every clinical work will be followed by the laboratory work. Hence, right from the first year BDS, all the students will be associated with the Department of Prosthodontics to practice the different preclinical work. So, having a thorough knowledge about both laboratory as well as the clinical work is must, and they equally play important role for the success. So, being in learning phase or learning stage, every student must practice the listening skills, because the faculty who discuss the theory class or the small group discussions will be sharing a lot of theoretical knowledge as well as their clinical experience, so that listening to the complete discussion without distractions will be there always, but overcoming it and participating in the discussion makes us very confident whenever we deal with the cases. The second aspect is the identification of importance of that particular topic or the recognition of the significance of that particular topic. This happens only with a proper listening of the discussion or the theory class. So listening to the topic with a complete orientation as well as the identification of that particular uh, importance of the topic, where it is exactly indicated which clinical situation or the which laboratory situations we need to incorporate or implement that particular technique is very important aspect. After careful listening to that topic without distraction and identifying or recognition of importance of that particular topic, we need to remember it. We need to recall that particular aspect whenever it is required. For that, we need to practice thoroughly and prepare our own notes so that we don't forget it. The later stages, whenever the clinical situation or the laboratory situation requires the implementation of that particular technique, yes, we need to perform it in a proper way. So all these four aspects mentioned in this slide are interrelated. Proper listening or orientation without distraction, identification of the importance of that particular topic, and remembering the topic by practicing it, by preparing your own notes or having a discussion with the faculty if at all any doubts arises, and performing it without failure whenever it is required, because most of the dental procedures are not repeatable. So repeating the clinical procedures again and again may spoil the confidence aspect of the patient. Whenever patient loses confidence on the operator or the dentist, the question arises about the treatment outcome, the success of the particular treatment. It is even more difficult to manage that situations rather than practicing these listed points over here. There is a reason why I mentioned about these four important points before I start discussing about the actual topic. Recently, one of my senior teachers said, nowadays we listen only the half of the content and we'll try to remember only the 1/4 of that content, and when it comes for the final performance, we don't do anything. So keeping that statement in mind, I prepared this slide exclusively for the students who are still in primitive state of their preclinical work. Always remember, whatever discussion happens in any department by any faculty, try to implement all these aspects. And when it comes to the actual topic, since we use a lot of technical terminologies whenever the discussion happens or the theory class happens, I wanted to give few important definitions regarding this particular specialty. Definitions. I think by this time you all understood the importance of definition. Definition is one aspect where we give a clear outline about one particular concept or technique or the procedure. So it is always suggested to start with the definition for any topic, even for your theory examinations. If the particular question having a definition, we supposed to mention it in proper way. Proper way in the sense, every definition will have a keywords, particular keywords. Without mentioning that keywords, there won't be any meaning for that definition. Say for example, here I have mentioned the definition of prosthodontics and the keywords are mentioned here in a different color. In that way, every definition will have a keyword that must be remembered in proper way. So the definitions which I am going to discuss right now are taken from the Glossary of Prosthodontics Terms, which was published in Journal of Prosthodontic Dentistry. It is called as the GPT-9. Till now, there are 9 editions published about the terminology we generally use in prosthodontics. Prosthodontics is one specialty which was recognized in American Academy of Dentistry in 1947. In 1947, they recognized the prosthodontics as a separate department, and from then onwards, that specialty was developed in different countries. The first edition of the Glossary of Prosthodontic Terms was published in 1956. and from then onwards, till now, 8 editions were published, and every publish, the terminology or the definitions was refined and put forward. Now coming to the first definition of this particular topic, the prosthodontics. It is a branch of dentistry pertaining to the restoration and maintenance of oral function, comfort, appearance and health of the patient by the restoration of natural tooth or the replacement of missing tooth and craniofacial tissues with artificial substitutes. This definition carries a lot of meaning. Now, if we look into the different keywords over here, it is basically restoration, means rehabilitation and maintenance of oral function, comfort, appearance and health of the patient. So these keywords mentions clearly what this definition is made for. And the restoration of natural teeth or replacement of missing teeth, and also certain procedures in this particular specialty deals with a replacement of missing structures in craniofacial region with an artificial substitute. Artificial substitute relates a lot, so many materials that includes metals or resins or the other form of materials which deals with the. So the first definition, prosthodontics, has given a clear-cut visualization what a prosthodontist do, what clinical conditions we deal with. The other definitions followed here I have categorized according to the first based on the clinical condition. So based on the clinical conditions and presence of teeth or absence of teeth, they are divided into dentulous, partially dentulous, completely dentulous. Apart from that, the defects which are located in the maxillofacial region or craniofacial region. The definition of dentulous includes a condition in which natural teeth are present in the mouth. The synonym of this particular condition is called dentate, means possessing a natural dentition or teeth. The second definition is about the partial edentulousness or partial edentulism. They defined as the absence of some but not all the teeth in the dental arch. I mean to say the absence of some but not all of the natural teeth in the dental arch. So the approach for this particular situation, partial edentulous situation, is completely different than the completely edentulous situation or the dentulous situations. That's why when we understand the different conditions and their definition, exact definitions, automatically that gives clear-cut visualization of the approach of every situation. The third definition I have mentioned in this slide is completely edentulous, mean without teeth or lacking of teeth, or also can be defined as the state of being without natural teeth is called completely edentulous. The last one is the maxillofacial defects. It is a branch of prosthodontics concerned with the restoration and the replacement of stomatognathing and craniofacial structures with a processes that may or may not be removed on a regular or elective basis. This includes, generally we call them as extraoral restorations or the processes used to restore the anatomical structures of eye or ear or nose or ocular processes or the defects of the maxilla or the mandible with artificial substitute. They call it as maxillofacial defect. After understanding about different clinical situations like a completely edentulism or partial edentulism or craniofacial defect or the maxillofacial defect, we'll start planning the case and start with our clinical and laboratory procedures. So accordingly, we need to know a few definitions about this particular aspect. The first one is prosthesis in general. It is defined as an artificial replacement of an absent part of a human body, or also defined as a therapeutic device to improve or alter the function. Here I have mentioned few photographs like leg prosthesis, that is also prosthesis. hand processes, finger processes, and the other picture I have mentioned here is a heart valve processes which regulates the blood circulation in the heart. In that way, whenever we discuss about the terminology about the processes, that is considered to be in general. When it comes to the dentistry, we supposed to call them as the dental processes. It is defined as an artificial replacement of one or more tooth or teeth and also associated structures. That includes a simple crown, either metal crown or the ceramic crown, or removable partial dentures for removal or partial edentulous situation, or complete dentures for completely edentulous situation is called as a dental processes. So to perform all these procedures, as I told you before, we need to do some certain clinical procedures as well as laboratory procedures. Since second year undergraduate students more associated with the laboratory procedure, I would like to explain about the dental prosthetic laboratory procedure definition. That includes the steps in the fabrication of dental processes that do not require the presence of the patient for their completion. This gives a clear-cut picture what the meaning of the laboratory procedure. Followed by the definitions of the restorations, partial dentures, complete dentures, and maxillofacial processes. Restorations are defined as a broad term applied to any material or processes that restores or replaces lost tooth structure. Teeth or oral structures are defined as restorations. Whereas the partial dentures are given to the partially edentulous condition, and it is defined as a partial denture either removable or fixed that restores a partially edentulous arch or condition is called as partial dentures. Complete dentures are given to the completely edentulous situation, and it is defined as a fixed or removable dental processes that replaces the entire dentition and associated structures of the maxilla or the mandible with an artificial substitutes. The last definition here in this slide mentions about the maxillofacial processes that defined as any processes used to replace a part or all of any stomatognathing and craniofacial structures is defined as maxillofacial processes. The last slide of discussion for today is definitions of cast, diagnostic cast, primary cast, and definitive cast. As I said earlier, the prosthodontic specialty requires a wide range of laboratory work where we work in the model or a life-size likeness form for the fabrication of different ranges of processes. So accordingly, the cast is defined as a life-size likeness of some desired form. It is formed from a material poured into a matrix or an impression or from a CAM printed replica. Here the CAM reflects the meaning of computer aided milling, which is supposed to be considered as the most advanced technique in the field of dentistry. The other definition is a diagnostic cast. It is defined as a life-size reproduction of a part or parts of a oral cavity or facial structures for the purpose of study and treatment planning. These particular diagnostic casts are exclusively meant for planning the treatment, because after the clinical examination intraorally, sometimes we require a life-size likeness to evaluate the exact correlation of maxillary and mandibular dentition or the evaluation of the occlusion. So for that reason, for planning the treatment itself, sometimes we require a diagnostic models or the diagnostic cast. The other definition here is the primary cast. It is defined as a cast formed from a preliminary impression for the purpose or for the use in diagnosis and the fabrication of a custom impression tray. Sometimes we require a fabrication of special tray for the purpose of making a definitive cast or the master cast. For that reason, we make preliminary impression. On that we prepare a primary cast. The last definition is definitive cast. It is a replica of a tooth surface or residual ridge areas or other parts of the dental arch or the facial structures used to fabricate a dental restoration or the prosthesis. So this gives a clear-cut visualization what is the meaning of a definitive cast. Over the definitive cast, we plan the permanent restoration fabrication and execute it. With this, we have finished the preliminary phases of discussion about the different definitions like prosthodontics, the definitions of different clinical situations, definitions of the models and the processes. I suggest you to go through these particular definitions in proper way so that the next upcoming classes will be based on these particular definitions. So for further reference, I suggest you to search in the Google about glossary of prosthodontic terms, and it will be available in a PDF form within around 110 pages. You can just download it, you can make a hard copy and keep it with you whenever you're appearing to the preclinical labs. You can open up the definitions which you have quoted in that PDF file and read about it. And always suggest you to keep revising the definition so that it will be easy for you to recall the procedures or the techniques whenever we have a clinical or the laboratory discussions. Thank you very much. Have a good day.